Hi folks, welcome back to the channel. My name is Drew. I'm an accredited exercise physiologist and registered Chinese medicine practitioner with about 20 years clinical experience in exercise rehabilitation. In this video series, we're looking at functional anatomy. So we're learning the various structures and tissues of the body and how they kind of relate to movement, kind of exercise therapy, personal training, if you're into health and wellness and fitness, looking after your body, if you're a yoga teacher, any of those kind of professions. They're all based on a good understanding of movement. And if you really want to understand how things work in the body, you can get very good at learning how to do exercise. So for example, I know a lot of really amazing bodybuilders who have an amazing natural feel for their body, and they can pretty much isolate every muscle in the body and know exercises to isolate them and to work them. Amazing, but they may not necessarily know how to explain what's going on, which is cool. If you're someone like myself who likes to kind of understand the why questions, like how does it work questions, that's really rooted in a lot of anatomy and physiology and biomechanics. So typically what we would start learning is anatomy. And in this video, we're looking at the ligaments of the spine. And we're looking at 6 ligaments today. And just to give you a bit of an overview of what the ligaments in the spine do, they're very much overlooked. When lower back pain is a very common injury. Over 80% of people will experience lower back pain at some point. Typically, most lower back pain resolves itself within 10 to 14 days without treatment, which is kind of the big secret for a lot of chiropractors and kind of manual therapy, physio type things. Although that includes acupuncture, that isn't me. Though my experience is if you do get early treatment, your recovery is a lot better and the body will work better once you recover. Because what typically happens with an injury, there is micro tearing of fibers and connective tissue. There's a nervous system interruption, if you will. There is adhesions in the muscles, which can occur. And all these things need to be restored so you get optimal movement. So even if the lower back pain goes away after 10 to 14 days, it may be some residual stuff going on there which might predispose you or really mature movement moving forward. So it's always good to get it checked out and have some work done on it. And ligaments is one of the overlooked kind of components in lower back pain, mainly because there's not much you can do about a ligament strain or sprain. So once it's been sprained, it really kind of heals on its own, like versus like muscles and tendons and things like that. That used to be the thinking, but now we know that like connective tissue does have a metabolic uptake. It's a lot slower. Up to 500 days for connective tissue to really regenerate. So you're looking well over a year of rehab. When I blew out my left knee and did a grade 2 MCL tear with a bucket handle tear. So that's the middle ligament on the knee and the cartilage. I was told I need surgery for that. I went down the conservative route, used Chinese medicine, acupuncture, exercise rehabilitation techniques, and my knee is totally fine now. So it just have to be patient with it and do the right stuff. And so with ligaments, it used to be the thinking that you couldn't really do much with them. But like every tissue in the body, they're all living tissues. They all have either a blood supply or a lymphatic supply, or they have synovial fluid, hyaluronic acid. These all bring nutrients into the structures, and they can heal and they can grow stronger. That you might have some scar tissue laid down where the tissues are basically regrown together, but so you lose a little bit of pliability, a little bit of contractility, but in the aggregate, the tissue does heal really well. So in lower back, we can over time strengthen these ligaments, which is where like a lot of the long-term adaptations, things like strength training, yoga, Pilates, dance, martial art occurs, is the ligaments and the connective tissues get a lot stronger and a lot more pliable as well. So they can resist tension and force coming through. Now remember, the ligaments' jobs are to keep bones in positions so that when the muscles contract and pull on the bones, that there is a nice even movement through the joint, through where the bone meets another bone. So we don't really want to stretch ligaments, but we do want to over time strengthen them with appropriate exercise. So the key ligaments in the lower back are going to be this one here. This is the supraspinosus ligament. So it goes from the spine of each ligament here on the lumbar vertebrae. So supra meaning above, spine, supraspinosus ligament. So it's just ligaments going from the spine of the vertebrae right up. This will be that'll be the thoracic version. And there's not a cervical one there displayed here. So that's the first ligament. The second ligament is then we have the interspinous ligaments. So we've got the spine of the vertebrae here. And between each vertebrae, we have a really thick ligament, which basically keeps them nicely in good position as well. So this gives a lot of strength and integrity to the body. So a lot of this connective tissue is like one I described to one of my clients is very visual. It's like a sailing ship with masts, and you've got all the different rigging coming off to kind of strut and stabilize. So a similar kind of concept here in the body. Then the third one here, we have the intratransverse ligaments. So these are the transverse processes that are coming off from the side. So so between the transverse processes, so quite wide but thin ligament. And you're going to have a lot of muscular attachments onto here. So the quadriceps lumborum will be attaching onto these muscles here, absolutely. And then we then have this one here, this is the Ligamentum Flava. Okay, and then on beneath that, or behind that, we have the posterior longitudinal ligament and the anterior longitudinal ligament. So the anterior longitudinal ligament essentially encapsulates or covers the front of the spinal column, goes right up the front. So that gives it that kind of nice integrity from front. So if you do a back bend or go into extension, that ligament's going to tension and stabilize the vertebrae. And then the one behind it, the posterior longitudinal ligament, if we isolate that, this one runs all the way up the posterior aspect of the vertebrae there. So the spinal canal is coming down through here, the spinal cord will go down through there, and you've got this nice long ligament goes down the inside of the spinal canal, okay, on that part through there. That's the posterior longitudinal ligament. So you've got an anterior one on the front and the posterior one coming down the middle. And then the last one is, if you can see it, this Ligamentum Flava. So let me isolate that one. So this one is kind of going from one lamina to the next. So the lamina is this kind of part of, so if we get that, come back here, isolate that. So this is a lamina part here in a lumbar vertebrae. These just kind of arch of the bone through there. So they're attaching kind of on the inside through here. There. So that's giving that segmental up and down the spinal column attachment. So when you kind of add with those together, you have the anterior longitudinal ligament, the posterior longitudinal ligament, and the ligamentum flavum, all giving that nice stabilization right at the spinal column. And then you have the three kind of transverse processes and spinal process ligaments here. So the interspinous ligaments, the supraspinous ligament, and then the intratransverse ligaments. And they essentially thread right up the spine. Then when you come to the thoracic, we have a couple more. So we have the intertransverse ligaments thoracic, And these ones are going from the transverse process. So this would be, for example, L5, and it's going up here, kind of onto the almost the body of the thoracic vertebral body there. And they thread right up. And then you have going right up the spine. This kind of region here is kind of interesting. It kind of goes in and it goes out like that. And then they thread up basically from transverse process to transverse process right up the spinal column. So you get this kind of nice rigging going up and down the back to help stabilize the spine. So they would be the key ligaments of the back. So typically in an acute injury, depending what's going on, maybe if you injured this area, the right lower back, and you forward flex and rotate it to the left, that's going to stretch this ligament in here and potentially stretch ligament here, the supraspinous ligament. And like any ligament, they can have a grade 1, 2, 3. So grade 1 is just a pull. Grade 2 is you've got fiber tearing, and grade 3 is you've got significant fiber tearing, maybe even a full rupture. And so initial lower back injuries will incur some ligamentous kind of into action as well with it. So just something to be aware of. So how do you treat it? Key thing is when you have a lower back pain, the key thing is that the acute inflammation phase, which will last typically 24 to 48 hours. Okay. You want to first avoid the thing that's creating the pain. Make sure you're safe. That's key. Second stage is then to find a comfortable rest position where you can get out of pain. And then you might be lying on the ground, on your back, on your side, on your belly. You're trying to find a position of comfort. So you're out of the position where you're tensioning the injured site. And typically in that first 24 to 48 hours, unless you've got really severe kind of neuropathic pain where you've got symptoms going down into the leg or into the bladder and you're losing muscular function, at that point, if you don't have any of that kind of pain, you just need to rest. Maybe get some treatment in that kind of second day. The first day, you're just going to be inflamed. There's going to be lots of swelling. So you just need to basically take it easy. Maybe some over-the-counter pain relief can be quite helpful. And then get it assessed. If you have pain where you get a foot drop or you have interference with your bowel or bladder action particularly, or it's radiating pain shooting down the leg or into the groin, you may want to get that assessed straight away. There are some kind of acute lower back pain where they can give you some really, really good drugs, particularly if you've got neural impingement or nerve impingement, just to kind of get you through that initial inflammation phase. And then we want to get into some kind of treatment as quick as we can. So that means chiropractic, osteo, physio, acupuncture, remedial massage. They're all really good. They've all got techniques to help manage pain. Essentially, you want to decrease inflammation, manage the pain response so you get normal pain response, and then reposition any spinal segments that are out of alignment. That's typically due to muscular spasm and guarding, which is going to create torsion and twisting. So if you've hurt your right lower back, you tend to either shift to the left or to the right to take pain off the site, depending on what's going on. And so once that tissue starts to heal, if you don't kind of restore the position, you can kind of get stuck in that kind of compensatory position there. And that's where people get kind of like caught in mechanical pain syndromes. Because essentially pain is derived from 3 areas. It's mechanical pain or nociception. It's tissue and structures in the body are getting signals from the tissue, from the muscles, from the tendons, from the joint, into the spinal cord, up to the brain to say, oh, something's wrong. So that's your typical kind of mechanical injury. Then you have neuropathic type pain where the nerve is getting impinged or compressed. So that would be like a sciatica type of pain. Perhaps you've got a disc prolapse, and so the nerve root's getting compressed, and so that's interfering with the actual conduction of signals coming back and forward from the nerve. So then that needs to be addressed at where the compression side is. So you definitely want probably some kind of treatment for that. Physiotherapy, chiropractic, osteo, acupuncture will be really helpful to address, try to decompress the nerve. Extreme cases, that might be a surgical intervention. And then there's kind of top-down pain where the brain has interpreted a pain signal for whatever reason. And then even after the tissue has healed, the brain is still interpreting pain as it's still there. And so the pain is still kind of coming up and down through the body. The brain is signaling the pain signals to be there even when there is no injury or it's healed. And so if the brain thinks it's going on, it's going to interpret that, and it's going to process the feelings of pain from the brain, and that can then transfer down into the injury side. So you can almost mentally create pain. That's a lot of chronic pain issues come around, and that kind of really orientates around trauma, fear, aversion, anxiety. So you get a lot of people who had a really severe back pain, they get into avoidance. They don't want to do a certain thing because previously that hurt their back. So they avoid those positions. Just thinking about it can trigger pain. And so when they avoid those positions, you stop using muscles in a certain way. Then you get imbalances and weakness, and then that becomes a mechanical pain problem as well. So you can get multiple things happening at the same time. So the trick of a good clinician is to try to figure out, is it a tissue issue? Is it an issue in the tissue? Is it a compression of a nerve issue? Or is it a kind of a compensation, learned habitual processing issue? So is it going from the brain to the body? Is it coming from the body to the brain? Or is it coming from the spinal cord to the brain and out to the tissues? And so we need to figure that out, because your treatment's going to be kind of dictated on the mechanism where the pain's coming from. And if we can address that core root, then you can kind of resolve a lot of people's pain quite easily. The trick is pain can be masked. Everyone has a different kind of quality of pain, different threshold of pain, different tolerances to pain, different triggers to pain. So it can be quite tricky and quite complex to work out. And so if you can get a good therapist who's been working in the space for a long time, they can kind of help guide you through that process, which is something that I definitely recommend you do, because being in pain sucks. You don't want to be in pain. And so that brings me back around to this video in ligaments. So the best way to get your ligaments strong is to train them. And the best way to train your ligaments is a good structured exercise program. Everyone's different. So you could do it with a good strength conditioning program in the gym, lifting weights. You could do it with calisthenics, kind of like gymnastic strength training, pretty good. Pilates and yoga do a lot of spinal movement. Particularly, they do a lot of flexion, extension, rotation, or twisting. So you get all those little segments kind of trained. So they can all be really good to get the back strong. Okay. The key is to find a good movement professional who understands what they're doing, understands progression, how to get your program to build it up, meet your capacity, your individual kind of preferences, and what you can and can't do, and then you take it from there. Okay, so hopefully that video was helpful. A quick one on ligaments of the spine, and keep training, stay curious, stay humble, and we'll see you for the next one.